Dr. Sam. I'm a board-certified urologist. I work next to Ogden Regional Medical Center in the Ogden Specialties Clinic. There's a very large problem in our population with incontinence of urine, where the urine actually comes out when we don't want it to. There are several different kinds of incontinence. Women notice it particularly after they've had babies and they've had stretching out of the tissues. It doesn't come back to normal, and they can have something called stress incontinence. So when they cough or sneeze or laugh, pick up something heavy, they can lose some urine. Unfortunately, there aren't too many things to do for that besides surgery if it's bad enough. The surgery is very effective. It works well. On the other hand, there's another kind called urgency urinary incontinence, and that's the kind where you feel like you have to go and you just can't get there in time. And for that, there are typically some behavioral changes that can be done that will really help. Some strategies to help cut down the urge when it strikes, and there are medications that are very helpful in accomplishing that. There are some other kinds of incontinence as well, and that one is called overflow incontinence. This typically is happening in men who have large prostates, and they simply do not empty their bladder. They have a very high residual urine, and they go often, and sometimes the urine is just coming out because their bladder is so full. It's very important to come and see basically a urologist, because we're the ones that are most equipped to take care of that. The other part of that is you have to be treated appropriately. You'd have to define what the problem is and then treat it. There are a lot of people who are having difficulty with incontinence, and as folks are aging, they may find that they're having a problem. They may say, oh, this is just part of getting older. No, it's not. There are people who have difficulties at any age, and they should be resolved.